The Lagos State government has joined the world in celebrating World AIDS Day. This year's theme, Overcoming Disruption, Sustaining Nigeria's HIV Response, is to ensure continuity of HIV services and support to create healthier communities. Senior correspondent Adedoja Salamadeni has more.
Lagos State has an estimated 160,000 residents living with HIV, with 147,466 individuals currently receiving antiretroviral treatment. This work is about raising awareness among residents about the importance of getting tested and seeking treatment if necessary.
The work began from Alausa through Obafemi Awolowo Road to Allen Junction. Flyers and preventive items are distributed to residents to take caution in preventing HIV transmission. Chief Executive Officer, Lagos State AIDS Control Agency, Folakemi Animashaun, says the state government is stepping up efforts to combat virus from spreading.
Lagos is still leading when it comes to HIV response in Nigeria. 11,000 plus that have been lost to follow up. We need to trace them, so we are doing contact tracing presently so we can bring them on board on treatment. And the people on treatment, 147,000, we are ensuring that they are getting the ART, that is the antiretroviral medications, to ensure that they have a suppressed viral load in order to reduce the spread of the virus.
What we try to do is that when people go out for outreaches and so on, we ensure that they have access to care. When you do now know your status, we link you up to where you have free antiretroviral therapy. So we want people to know that even when you know your status and it is positive, it's not a death sentence.
Lagos World AIDS Day also features empowerment program for over 200 persons living with HIV. Kuye and Bimbo have been living with the virus for over a decade and explain how life has been so far.
I've been on ARV since 15 years now, and since that time only the sickness that I can say I have is malaria, and it's a general sickness.
I am 62 years old. I've been living with this virus since 19 years ago. So this what they gave to me to sustain me, to be keeping me, because I don't have child, I don't have husband, so I'm living alone.
Stigma is a major hindrance in HIV prevention efforts and affects those living with the virus. For Lagos State, there is an anti-stigma law in place. The law prohibits discriminatory practices, including denial of access to health care, education, or employment based on HIV status. Adedoja Salamadeni, TVC News, Lagos.
Let's bring in Deputy Director, Head Policy and Advocacy Division, a national agency for the control of AIDS, Dr. Miriam Ezekwe. Dr. Ezekwe, thank you for joining us on the news at 7. The federal government has approved $200 million for HIV, TB, and malaria programs. From a policy and advocacy standpoint, what concrete gaps will this kind of funding address, and what mechanisms are in place to ensure the resources directly strengthen Nigeria's HIV response, especially at state and community levels where inequalities persist?
Thank you. Good evening, viewers, and happy to be here. This is a very good question that you just asked, and this salutes the quick action on the part of the president of our country, President Ahmed Bola Tinubu, because these funds came in at a time when disruptions came up as a result of changes in the policy of the United States. So these funds directly goes to key commodities such as HIV drugs and test kits. These are the two most singular needs to sustain the HIV response in the country. Of course, there are other aspects such as the monitoring, supervision, and even follow-ups that are necessary to ensure that the persons who live with HIV are maintained and adhere to treatment. One of the major challenges that we have is that we do have policies, but how do you enforce those policies? And one of them is ensure that everyone, because there's something we call the 95-95-95 cascade by the year 2030. It means 95% of persons who are HIV positive know their status. And you can only know your status when you are tested. So that really went a long way. The next important thing is maintaining, being on treatment, and the third is being virally suppressed. So that intervention came in at the right time. And looking further in the future, the way to sustain this is to ensure that we have systems such as health insurance that would be able to do the provision of test kits and drugs routinely. And I'm happy to say that there is expansion in coverage from a minimum of about 10% of our population to about 20% of our population being on health insurance. And some states, particularly 12 states in the country, have expanded coverage through health insurance for persons living with HIV and AIDS. So I think we are finally getting where we want to be. We are already on the path towards sustainability.
Yeah, I like the fact that we had in that report the emphasis on strengthening local sustainability, and you're also saying that we're on the path. But stigma remains one of the biggest drivers of late diagnosis and treatment avoidance. What are we doing to tackle this on a more sustainable platform and process?
Okay, great. Stigma is a challenge, and so far, the National Agency for the Control of AIDS has established gender human rights state response teams in all 36+1 states in the country. And these are bodies that work with the Human Rights Commission, as well as the Legal Aid Council, to ensure that persons whose rights maybe who lose jobs, who are discriminated in families, have redress, because there's no law that doesn't have, if it doesn't have something to back it in terms of punishment, then some people may get away with contravening the law. So the other states who have not, like I mentioned, 23 states have already established the anti-stigma law. So we are working to ensure that they also pass this law and this law comes into force. That's one. Another way is that we are working very closely with traditional institutions and religious bodies to get the message out there that HIV is not a disease of shame, but something that can be brought to the table and discussed. Because everyone knows that in our country that if you want something to really get down to the grassroots, then it has to be owned. There needs to be ownership at community level.
All right.
And two key institutions are the traditional and religious institutions.
Good place to leave it. I've been speaking with Deputy Director, Head Policy and Advocacy Division of the National Agency for the Control of AIDS, Dr. Miriam Ezekiel. Thank you for talking to us.